Dear students, welcome back. In the previous session, we have discussed about thoracolumbar fascia. Now, in this session, we are going to discuss about another structure which is related to the posterior abdominal wall, that is lumbar plexus. Okay, so this lumbar plexus chiefly supplies the lower extremity, and it is formed by the anterior primary rami of upper three lumbar vertebrae. Okay, three lumbar nerves, and a major portion of the anterior primary ramus of fourth lumbar nerve. That means from L1 to L4, the lumbar plexus is going to take part. And also a small branch, or we can say small twig, which is coming from T12 also unites with the L1 to form the branches. Okay, so the lumbar plexus are mainly formed by upper three lumbar vertebrae, that is L1, L2, L3, and major portion of the anterior primary rami of L4, and a small twig of nerve which is coming from T12 is also taking part in the formation of lumbar plexus. Okay, so if you see the L4, so I have told that the major portion of the anterior primary rami which is taking part in the lumbar plexus. What about the other part, isn't it? So normally this L4 bifurcates, that means it divides into two, and a major portion and a minor portion. So after bifurcation, it takes part in both the lumbar as well as the sacral plexus. So that minor portion will take part in the formation of lumbosacral trunk. Okay, so this is that part which is taking part in the formation of sacral plexus, so which is called as nervus furcalis. So the L4 bifurcates to take part in both lumbar and sacral plexus, and it is called as nervus furcalis. Okay, so this is the introduction of lumbar plexus. What are the root values of this lumbar plexus means L1 to L4, and out of L1 to L4, the entire lumbar nerves which take part in lumbar plexus is L1, L2 and L3, and a small twig which is also coming from T12. Okay, now if you can see the prefixation, that means prefixation and post-fixation of the plexus. So the same thing, prefixation and post-fixation, we have already studied in brachial plexus. Okay, here how it is formed in prefixation. Okay, instead of L4, so in the prefixation, instead of L4, this L3 becomes nervus furcalis. That means bifurcation of L4 like this is going to take place in L3. Okay, that means the plexus is shifted towards the cranial side. Then it is called as, such plexus is called as prefixed plexus. Okay, so in sometimes the same kind of this nervus furcalis, instead of forming in L4, it may forms in L5. Then what happens? The plexus is towards the caudal side. Okay, so if such segment, the L5 is forming the flexor, nervus furcalis, then that lumbar plexus is called as post-fixation of plexus. Okay, so normally such variations are associated when the vertebral column is having some um, malformation, that is sacralization of the lumbar vertebrae. In such condition we can see such kind of post-fixation or prefixation types we can see in variations in the vertebral column. Okay, so this is about the introduction, that is which roots are involved in the formation of lumbar flexus and prefixed and post fixation of lumbar flexus. Now, so here the formation of flexus, so the mode of formation of flexus is entirely different with the other flexes which are present in the human body. Okay, and normally if you see in the brachial flexus we have seen a sequence how the flexes are formed. That means it has a root, isn't it? For flexus it has a root and then trunk, isn't it? And then divisions and then cords and finally branches. So many stages are there in the formation of flexus in the case of brachial flexus. But in the case of lumbar flexus, such kind of variations is not present here. Okay. So how these flexes are formed in the lumbar region, now we are going to see. Okay. So where it is exactly situated? The lumbar flexus is situated on the posterior substance of the psoas major. Okay, and if you see the formation, mode of formation of the lumbar flexus, or so I want to mention it. So you have to note it and you have to focus clearly here. Okay, so if you see, we have already known that L1 to L4 is forming the flexus, isn't it? So what happens here means, if you see this L1 and L2, these two nerve roots, okay, so here the anterior primary rami of L1 and L2 is divided into upper division and lower divisions. So here this is the nerve, okay, and its small twig of T12 is also uniting here. After this it is divided into upper division and lower division. The same way the L2 also dividing, okay, L2 also dividing upper division and lower division. L3 will not divide into upper and lower division. So this is very important here. That is, L3 is not dividing upper and lower divisions. So you have to keep it in mind. And again L4, okay, L4. So already we know that some part of the L4 is going to help in the formation of sacral flexus. Okay, so leave that part. Okay, and if you see this, the major portion of the L4, this one is also, that is, the L4 is also divided into upper and lower divisions. So this one is also divided into upper and lower divisions. Okay, so if you see, out of 4, L1, L2 and L4 is going to divide into upper and lower divisions. Okay, if you see the L3 will not divide into upper and lower divisions. Okay, so we will see this L3 after some time. So now we will see L1 here. So the L1, if you can see The L1, I have told that the L1 will take a small twig from the T12. Okay, it is taking some small twig from T12. After uniting with T12, it is divided into upper division and lower division. Here, very important thing, the upper and lower division is there. Out of these two, which one is larger and which one is smaller division, you have to consider here. So here the upper division is larger and lower division is smaller. Okay, so upper larger division and lower smaller division. Okay, so this upper division, okay, the larger upper division is going to give two branches here. So what are the two branches? Iliohypogastric nerve and ilioinguinal nerve, or the branches of upper division of L1. Okay, L1. Yes. Next one. So here what is the branch remaining here? Smaller division is remaining. Okay. Now we will move on to L2. So in the L2 also, what are the divisions we have seen? Upper division and lower division. Here a slight difference is there. So here the upper division is smaller here and lower division is larger. If you can see the course also we can find. So the lower division is somewhat bigger than the upper division. Okay, so this is the lower larger division and upper smaller division. So now we will see the L1 smaller division, and L2 upper smaller division, okay, unite to form to give a branch called as Geneto femoral nerve. Okay, yes, we will move on to L4, not L3. So we'll move on to L4. Here the L4 divides into larger upper portion, again same as L1, larger upper portion and smaller lower portion. Okay, smaller lower division, upper and lower division. So here the lower division, the smaller lower division forms in the lumbosacral trunk. Okay, now what are the remaining thing? L3 is remaining. Okay, now we will see what are the other divisions remaining here. So for L2, larger lower division, okay, the entire L3 is remaining, and L4 upper division is remaining. That means upper divisions of L2, that is greater portion, okay, that is greater portion which is present in the L2 is lower branch. Okay, for L4 the upper part is the what? Greater division. So now what happens? So the greater divisions of L2, the entire L3 and the L4 is going to split again. So now these three divisions are again going to split into dorsal branches and ventral branches. So the entire L3, so entire L3 doesn't have any upper and lower branches. So this L3 is directly divided into dorsal and posterior. So this light yellow color is anterior division and orange is posterior division. So everyone, so this L4 upper division also divided into dorsal and ventral branches. Dorsal and ventral branches. Okay, now it is clear? Yes. Okay, I will show you this thing, the dorsal and ventral branches. Now we will see. So the greater portion of the L2, the entire L3, okay, the entire L3 and greater portion of L4 are divided into dorsal and ventral portions. So here you can find this. This is dorsal and ventral. Again dorsal and ventral. Again dorsal and ventral. Okay. So this is the thing happening now. So now we will see the dorsal branches. So the dorsal branches of L2 and L3. That means dorsal branches of L2 and L3 both forms the lateral femoral cutaneous nerve or lateral cutaneous nerve of thigh. Okay, now we will see another dorsal branches. Okay, the dorsal branches of, so again we will see the dorsal branches of L2, dorsal branch of L3 and dorsal branch of L4. So all these three dorsal branches unite to form the very important nerve, that is femoral nerve. And in the midway it is also gives some branches to iliopsoas and iliacus also. Okay, now and another, so we have finished the dorsal branches. Now what are the branches remaining now? Ventral branches are remaining. Yes. Now ventral branches. So what are the ventral branches present? So what are the nerve roots? L2, L3 and L4 ventral branches are remaining. Okay. So the ventral branch of L2, ventral branch of L3 and ventral branch of L4, all these three unite to form obturator nerve. Okay. Sometimes only the ventral branches of L3 and L4 forms the accessory obturator nerve. This nerve sometimes may be present or may not be present. Okay, so these are all the branches which are formed by the union of these dorsal as well as the ventral branches. Okay, so I hope everybody will understood up to this thing. Yes. So now this is the mode of formation of lumbar flexus. Okay. Now we will see the branches. I have already mentioned the branches also. But some of the branches which are coming from the root itself. Okay. So what are that branches? Now we will see. Okay. So the branches, mainly the muscular branches which are coming from the root stage, supplies to psoas minor. If psoas minor is present, then only L1 supplies the psoas minor. Okay. And if it is psoas major, the psoas major is supplied by L2, L3 and L4. All these three nerve roots give branches to the psoas major muscle. Okay. Only L1 is for psoas minor muscle. Okay. For the iliacus, the nerve roots which are giving branches for the iliacus is only L2 and L3. L2 and L3 gives branches to iliacus. Okay, these are all the branches which are coming from the roots. Okay, so these are all the branches which are arising from the lumbar flexus. We will see again this thing. Yes. So what are the branches? Iliohypogastric nerve and ilioinguinal nerve, which is coming from the nerve root L1 as well as T12, majorly L1. And if you see the genitofemoral nerve, it is the nerve root is L1 and L2, and lateral femoral cutaneous nerve, it is L2 and L3. So this is a dorsal branch. And next femoral nerve L2, L3 and L4, all dorsal branches. And obturator nerve, ventral branches of L2, L3 and L4. Accessory obturator, if present, ventral roots of L3 and L4. Okay. Now we will see how these branches are related to the psoas major muscle. Yes, here you can see this is the lumbar region, that is posterior abdominal wall. You can find, so this one is the psoas major muscle and this one is the psoas minor muscle. So how these branches are emerging out on the posterior aspect of this muscle? Yes, now we will see. So the iliohypogastric, okay, the iliohypogastric nerve, ilioinguinal nerve and lateral cutaneous nerve of thigh. So here you can find those nerves also. So this is the psoas major, and above this psoas major you can find the nerves. Okay, one is the iliohypogastric. This is the iliohypogastric, and next one is the ilioinguinal. So this side you can see very clearly. Why? Because the psoas major muscle is cut here. Okay, so for that reason you can find this iliohypogastric and ilioinguinal nerve. Okay, after that, what is the nerve? Next nerve is the lateral cutaneous nerve of thigh, or we can call it as lateral femoral cutaneous nerve. So this is the lateral femoral cutaneous nerve. Okay, and also the femoral nerve. So the main nerve, here you can find this, here you can find the femoral nerve. So these are the four nerves. So if you can see all the four nerves which are emerging out of the lateral border of the psoas major muscle. If you want to see, so all these four nerves will come in the same order. So first one is iliohypogastric, ilioinguinal, okay, and lateral cutaneous nerve of thigh, and then the femoral nerve, which are emerging out of this lateral border of the psoas major muscle. Okay, now next, what are the nerves remaining now? Genetofemoral nerve. So this genetofemoral nerve pierces the anterior border of the muscle at L1. So normally this genetofemoral nerve will emerge at this level, at the anterior border. So above this, okay. So that here we can't see this genetofemoral nerve, but on the anterior aspect it is emerging out. Okay, at the L1 level. This is the L1 level. So next one is the obturator nerve, which emerges out of the medial border of the muscle. So at the medial border of the muscle, so here you can find the obturator nerve. So this is the obturator nerve, which is emerging at the medial border of the muscle. Okay, so you can find here here the nerve is going to emerging out. Here the muscle is covering it this way. So on this side you can find this obturator nerve. And next one is the accessory obturator nerve. If present, it is also emerging from the medial border of the psoas major, which is below the obturator nerve. So these are the nerves which are related to the psoas major muscle. So how these nerves are related to the psoas major muscle. So this is all about the lumbar flexus. How the lumbar flexus, what do you mean by lumbar flexus? What are the root values of the lumbar flexus? When it is called prefixed lumbar flexus and postfixed lumbar flexus, where it is situated and how the lumbar flexus is formed, and what are the branches of the lumbar flexus and how these branches are related to the psoas major muscle. All these things we have discussed in this session. Okay, in the next session we are going to discuss about the abdominal aorta. Thank you.